Hello and welcome. I'm your host, Avery Schumacher. I'm an attorney in Epstein Becker Green's healthcare and life sciences practice based out of our Columbus office. In recent years, incidents of workplace violence in healthcare settings have been on the rise, capturing the attention of both state and federal lawmakers. And as awareness grows, so too does legal scrutiny and the push for new regulations and enforcement. In these seemingly critical times, what should healthcare employers be thinking about and incorporating into their comprehensive strategies to prevent and address workplace violence? Today on Diagnosing Healthcare, we dissect the legal landscape surrounding healthcare workplace violence, examining the steps being taken at various levels of government and what they mean for healthcare providers and institutions. Join us as we explore the legal frameworks, emerging policies, and the broader compliance implications for healthcare employers. If you like what you hear today, please subscribe to the show. Diagnosing Healthcare is available wherever you get your podcasts.
Welcome to Diagnosing Healthcare, a podcast featuring thought-provoking conversations about the latest legal, policy, and regulatory issues in healthcare and life sciences. Brought to you by the lawyers at Epstein Becker Green.
Joining our discussion today is Sharon Peters, a member of the firm in our Portland office. Hi, Sharon. Thanks for joining us today.
Hi, Avery. Thanks for having me.
Also joining us today is Eric Neiman, a member of the firm based out of our Portland office as well. Hi, Eric. Thank you for joining us too.
Happy to be here with both of you.
Before we dive into the legal frameworks evolving in response to the problem of healthcare workplace violence, it would be helpful to understand more about the problem itself. It is my understanding that healthcare workplace violence refers to any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs in a healthcare setting, and that it can involve a mix of workers, patients, visitors, or anyone within the healthcare environment. Sharon, can you provide an overview of the recent trends in workplace violence within healthcare settings? What data or statistics are available to highlight the severity of the issue?
Sure, Avery. Let me start with a couple of statistics that I believe really show the issue here that we're facing. The Bureau of Labor Statistics reports that 73% of all non-fatal workplace injuries occurs in the healthcare sector. That's by far the clear majority of workplace injuries faced by healthcare workers. In a recent survey by the American College of Emergency Physicians, 85% of ED docs report that there has been a significant increase over the past 5 years of incidents of workplace violence in their emergency department. And we're hearing the same thing from nurses and other caregivers, which is having an effect on employee retention. In fact, just recently, there was a survey reported by the American Medical Association of nurses. This was in one particular state in the upper Midwest, and 32% of nurses reported that they were planning to leave their workplace. And that was because of workload concerns, but in particular, emotional exhaustion and reporting an abusive and violent environment. These statistics you can find anywhere and everywhere. They appear to be showing an increasing trend. So I think it's important when we're talking about workplace violence in the healthcare sector to talk about or identify exactly what that is. There's perhaps 3 key sources of workplace violence. I like to think of them as these categories when we're also thinking about prevention and response. The first is violence from an outsider, a third party. These are those horrible headlines that we are unfortunately still seeing where a gunman comes in. This happened recently in Portland, in one of the hospitals, comes in from the outside and issues a violent attack. The second is from a known relation with an employee or a worker. So perhaps it's a domestic violence situation or stalking or something of that sort where the healthcare worker has an outside source or risk of violence, but that's affecting the workplace. The third and really quite challenging, they're all challenging, but really quite challenging source of workplace violence comes from patients or families or visitors of those patients. And the reason that this is so challenging is that source of violence is inextricably connected with the care that's being provided by these workers. These are the situations where you have a patient who, of their own volition or not, is acting out, throwing things, issuing verbal threats or assaults, hitting, biting, fighting the person that's trying to provide them care and trying to help. Sometimes this comes from family members out of anger or emotion or fear about what's happening with their loved one's care, and they're acting out against the caregivers that are trying to assist, or the same as with visitors. So we're seeing this happen. It's a tough situation. There aren't perfect solutions, but we're seeing a lot of great ideas out there.
Thanks, Sharon. Certainly helpful context. Eric, what factors are contributing to the rise in workplace violence incidents in healthcare? Are there particular roles or environments within healthcare that are more prone to violence?
Certainly, the trend is upward, unfortunately, and the data prove that. But this is not a new phenomenon. In 2016, OSHA, the Occupational Safety and Health Administration, issued a guidance document about violence in healthcare settings. And healthcare has been recognized for years as a place where the risk of patient aggression or the risk of situational violence is elevated. But things have certainly gotten worse in the past few years. The data show that as well, that the trends are going upward across the industry. So in offices, outpatient settings, but mostly in hospitals. And a hospital is a place where people are under a lot of stress. They're sick, they're uncertain. Can be a chaotic environment. There are areas of hospitals that are generally recognized and shown as being the most hazardous. Emergency departments, for sure. Waiting areas, psychiatric units, and long-term care and geriatric units. And we can also talk about the long-term care environment as a place where there is an elevated risk of violence. It's important here to say right up front, because we will be talking about behavioral health units, psychiatric hospitals, and psychiatric units within hospitals, that people with mental illness are not violent as a group, as a population. That's stereotyping and stigmatizing. People with mental illness are actually at more risk of having violence committed on them than they are committing violence by a long shot. But there are some patients, a small subset of people who seek care for behavioral health needs, who have aggression as a symptom of their illness. And so that makes the psychiatric setting as a place where there can be patient aggression and violence.
I appreciate you calling that out, Eric. As we've just heard, the rise in workplace violence is a serious issue. But how are lawmakers responding? This brings us to our next topic, emerging legal frameworks and policies. What are the federal and state governments doing to protect healthcare workers? Eric, what are the key federal laws and regulations currently in place that address workplace violence in healthcare? And I know you mentioned Occupational Safety and Health Administration guidelines. How do those relate to this issue?
There is no federal law that specifically regulates violence in healthcare workplaces. In November of 2022, CMS, the Centers for Medicare and Medicaid Services, issued a memorandum saying that it would continue to enforce an expectation of a safe environment for staff and patients. Effective January 1, 2022, the Joint Commission, the accreditation organization, added standards regarding workplace violence prevention for hospitals. And OSHA, which we talked about a bit ago, enforces workplace violence prevention standards through the General Duty Clause. But there is no specific federal law regulating or attempting to prevent workplace violence. And there's also no specific OSHA regulation directed to workplace violence prevention. OSHA has cited a number of hospitals, largely psychiatric hospitals and children's hospitals with psychiatric units, for General Duty Clause violations. There have been two main federal pieces of legislation in recent sessions about this problem. One is called the Safety from Violence for Healthcare Employees, or the SAVE, S-A-V-E Act. It criminalizes violence against healthcare workers in the same way that There are criminal law protections for people who work in the airline industry. Hospital groups support this. The unions of healthcare workers strongly support it. There have been marches on Washington. And importantly, there's a carve out for mental incapacity because people have been very concerned that a law like this would criminalize mental illness. And that has not passed. There's also what's called the Workplace Violence Prevention for Healthcare and Social Service Workers Act, which is intended to require the Secretary of Labor and OSHA to issue a national standard to prevent with workplace violence prevention methods across the industry. That passed the House in 2021. It has never come to a vote. And there is some opposition to that law, with the idea being that workplace violence prevention should be regulated at the state level as opposed to a federal mandate. I don't expect that there's going to be any action on either of those bills for the rest of this year during an election season. Although there is, I think, widespread recognition that some type of federal law would be appropriate.
This might be a good time then to segue into state law. But before I do, Sharon, did you have anything that you wanted to add on the federal side of things here?
We know it's often easier to enact safety-related type legislation on a more local basis than it is at the federal level, even if just from a practical standpoint of lawmaking. And that's exactly what we're seeing. The increasing state legislation, by my count, my last count, 18 out of 50 states have specific laws relating to workplace violence in healthcare. And this reflects the very real concern that's in the industry. As Eric was saying, there have been marches. There's strong advocacy from both sides on behalf of employees and employers. And we're tracking this state legislation weekly. That's how rapidly it's evolving. And it's been fascinating to watch. What we're seeing is that the state legislation has several different categories or approaches. One of those approaches is the consequence approach, I guess we could call it, which is when a law is enacted that makes it a crime to assault or threaten assault on a healthcare worker. And depending on the state, sometimes it's a misdemeanor, sometimes it's a felony. One way to look at this is that this is an entry point for legislatures. It's easy and simple to pass, has broad support from both sides, with the note that Eric provided about the concern about criminalizing mental illness. But there are ways to carve that out. In addition, it does provide this step that state legislatures are taking, is it does provide some confirmation or recognition of the quite severe problem. And it raises public awareness. There are questions about the effectiveness of criminalizing assaults against healthcare workers as a deterrent. And for example, many of the assaults that are being reported are happening in the moment. There are questions. It's easy to think about whether someone who is engaging in what we would consider to be workplace violence against a healthcare worker, whether there's a moment that they would stop and think about the consequences of their actions. But it's a start. The other approaches that we're seeing in the increasing state legislation has to do with compliance, prevention, assessments, record keeping and reporting. This is really interesting. We're seeing some states having very specific programs. Others are a bit more vague. But from an employer's perspective, while this does create additional compliance requirements that they must meet and they will be tested against, in a lot of ways, there's some benefit here, and employers are appreciating the specific standards and guidance. Workplace violence, particularly when we're talking about an assault from a patient, is a really tough issue. There's no perfect answer. I'd love to tell you that there's a way to prevent it from happening altogether, but I don't know that there is. The general duty clause that OSHA, federal OSHA, is utilizing to cite healthcare workers, in particular, some psychiatric hospitals, is really broad. It simply says, keep the employee free from a recognized hazard. That doesn't tell an employer really what needs to be done to help an employee feel and be safe. It's quite unhelpful. While some might see this increasing state regulation as onerous, many employers are seeing it as helpful. It provides a standard to meet, it provides some guidance, and these employers can point to compliance with those standards when OSHA, federal or state, comes knocking at their door, or labor unions are using the concern of workplace violence as a bargaining point.
Thanks, Sharon. It is my understanding that EBG recently published a 50-state survey on state laws and rules related to healthcare workplace violence. That survey will be linked in the show notes. Sharon, are there any notable trends or standout state laws that you can talk about based on your work on that survey and outside of it?
Yes, there are. When we worked on this survey, we used several categories, and that's what actually I'd like to talk about today. What we're seeing is that there are 4 categories. There's the consequence approach, like I mentioned earlier, where there could be a state law that criminalizes or provides that an assault against a healthcare worker is either a misdemeanor or a felony. So that's one approach. But from a more proactive standpoint, we're seeing laws that have specific assessment and prevention requirements, record keeping requirements, and reporting requirements. And I watch these happen every week. We're tracking bills across the nation. It was begging for a summary, and that's exactly what we've done with the survey. And it's categorized with those approaches. So I'll talk a little bit about each of those, if that's all right, because I think it's helpful for employers to be thinking about, even if they're not in a state that has these laws. So I want to make that part clear, that there's some states that have very specific requirements. And if that's the case, employers in that state need to pay very close attention, use it as a checklist, and make sure that they're meeting all of the marks that are required by their particular state, so that when their state OSHA agency comes knocking at the door, they can show that. But beyond that, it does also highlight some of the approaches that are being utilized, some of the ideas, and some of the best practices out there. So let me talk first about prevention. In terms of preventing workplace violence, again, I wish that there was a perfect solution to keeping the workplace risk-free, but I don't know that there is. But what an employer can do is actively conduct safety assessments and utilize their safety committee and the review process that their safety committee is engaging in to identify potential risks and mitigate those risks for workplace violence. And in some states, in Oregon and in Washington, for example, this is a specific requirement in the law for the employer to conduct a facility-specific safety assessment. So this means typically it's the safety committee actually walking around the building. If you have multiple sites, each building, taking a look, are there sight lines here that are creating an obstruction where perhaps there could be a worker that is by themselves and potentially at risk for violence? Is there enough lighting in the parking lot? Are there ways that we can adjust our staffing or our shifts in order to ensure that we have enough individuals available if we need 2 people available at a time to work with a person? What does that look like? So it's a very hands-on, site-specific and facility-specific assessment. And often the state laws specifically require that there be employee input and ideas in that assessment. And with that information that's received from that assessment, the employer can prepare a workplace violence prevention plan. Different states use different terminology to describe that, but it's essentially, what is our plan for this particular site and how are we going to address workplace violence? I think that's a great idea. And I think every employer should consider doing that, whether their state requires it or not. The involvement of employees and the input from them about what they're seeing and where their risks lie for them is key. As part of the prevention plan, training is also very important. This training can and should include de-escalation techniques, how to call for help, how to identify a risky situation, how to avoid a risky situation, training about the facility-specific plan, staffing, how to manage, how to call for help or ask for additional individuals to be with you. And otherwise, this type of training and this discussion raises awareness and encourages reporting, which can affect the culture surrounding workplace violence. One of the things that we hear there's statistics about this, but we also hear about it anecdotally, is that caregivers often feel that this is just part of the job. It's a hard job. If they're also feeling that being subject to a physical assault or a severe verbal threat or assault is part of the job, that will certainly have a toll on employee retention, on job satisfaction, and it also leads to underreporting. And so this is one of the things that training and the development of a prevention plan and talking about it can help, is changing that culture of this is just part of the job, because it's not. And we want to encourage employees to report what they're seeing and what they're experiencing so it can be reviewed on a periodic and regular basis, analyzed for identification of risk and continued improvement. State laws also include specific requirements regarding record keeping and reporting. Every employer should have an effective policy on reporting workplace violence. Already, this would be injuries that are reported on the OSHA logs or workers' compensation reporting. But these workplace violence laws that we're seeing enacted across the nation are taking an extra step. And often they're requiring the employer to keep a separate index or log of violence-related injuries and the details of the incident. That data can be useful when reviewed annually or periodically as trends can be identified. For healthcare employers, hospitals, clinics, assisted living facilities, residential treatment facilities, all types of healthcare employers, paying very close attention to your particular state's requirements is extremely important. We've worked with many employers who had fairly robust safety procedures already in place. And then we've seen OSHA become involved in the most difficult of situations. Say, for example, the patient who is continuing to act out, throw things, hit, curse, threaten, often not of their own volition. But it just takes one employee who's had enough to go ahead and reach out to OSHA and submit a complaint, even if the employer is working to try to address the situation. We see this often. Then what happens is that OSHA can come. They come to address the complaint. And while they're there, you can bet that not only will they review that instant situation, which may or may not be resolvable, but they will also conduct a broad audit of the employer's compliance policies. We've helped employers of various sizes prepare for this eventuality and guide through the development of a workplace violence prevention plan, record-keeping procedures, training protocols, and reporting. Because if those checklists, if those boxes aren't checked, you can bet that OSHA will issue a citation. They will mark that citation as serious, and they will be looking for opportunities for marking it also as a repeat citation. There is a real benefit to this effort, Avery, from an HR perspective, separate from compliance and avoiding OSHA enforcement. By taking on the policy and procedure and training challenges and talking about the issue with employees openly, the culture can begin to change. And we've seen this happen. Employees feel supported and protected. They know that their employer sees this as a problem. This encourages them to talk about it, to report their own concerns, and to raise ideas about how violence can be prevented.
Thanks, Sharon. As the legal landscape continues to evolve, healthcare employers must make changes in order to comply with these new laws. Sharon, in explaining the state laws, you've also touched on compliance strategies that employers can take whether or not their state actually requires it. In our final segment, we'll further explore the practical steps that employers can take to prevent and address workplace violence and ensure they are meeting their legal obligations. What are some best practices for ensuring compliance with federal and state laws on workplace violence?
I'll give a few specific ideas, Avery. There are a lot of ideas out there. It's been pretty fascinating to see across the nation some of the creative approaches that healthcare employers are implementing. But I'll give you three specific. First, an employer should take a look at their safety committee activities, ensure that their safety committee is meeting on a regular basis, should be at least monthly, and that the safety committee is including as part of its review consideration of workplace violence, their facility-specific assessment, as I discussed earlier, and reviewing any prior or recent incidents of workplace violence to determine whether there's any trends or consider any changes. The second is that record keeping is very important. in order for that assessment, that ongoing assessment to be done. So again, there's already requirements that are in existence for all employers to keep records of workplace injuries. We know that. But there should be a way to also tag it as being an injury that occurred from workplace violence, or there should be consideration of a threat of an injury as well, because that's perhaps an indicator of what might be happening in the future. So the record keeping for workplace violence incidents or threats of workplace violence is really important, not only from a compliance standpoint, but also to be able to review, assess, and analyze any potential changes or ways to mitigate risk. The last category that I want to mention, Avery, is training. Training is incredibly important because not only does it provide education to employees for the specific information that they need to know about this particular facility, what the policies are there about avoiding workplace violence circumstances or risk, how they should report, making sure that they have training on de-escalation, encouraging, asking them for help. But the more important, I think, benefit to this type of training is reducing the stigma associated with reporting workplace violence, because providing training about it, talking about it, and acknowledging that it's a difficult issue and encouraging employees to report and to present ideas about risk mitigation is incredibly helpful for both employees and employers.
Thanks, Sharon. So Sharon's talked about policies, record keeping, and training and education as important compliance strategies. Eric, what interesting and effective initiatives have you seen healthcare employers implement recently?
Sharon said there are a lot of good ideas out there, and there are. I visited and toured a brand new psychiatric hospital recently. They had incorporated into their design and construction many cutting edge elements for patient safety and staff safety. And just for two examples, the direct patient care staff team had distress alarms based on a GPS platform, so that if a staff member found him or herself somewhere in the hospital in a hazardous situation, they could trigger their distress alarm and their location would immediately be known to various people who could respond. Another thing they did was more controversial, which was plexiglass encompassing their nursing stations. That's controversial because of the therapeutic milieu that this is taking place in, and putting a barrier up between nursing staff and patients might send the wrong signal, but it was felt to be important for patient safety. Another thing I've heard about is use of an algorithm to predict potential violence situations. And AI is taking over healthcare like it is everywhere else. This algorithm had various inputs and was used to identify potentially violent situations or situations where there might be an elevated risk. That's a good idea, but it needs to be carefully monitored to identify risk of bias, because you could train that algorithm to identify situations which are false positives. It could end up with a discriminatory impact against a visitor to a hospital or a patient, or could even present a risk to patient care by identifying somebody as potentially violent, which would change the course of treatment for that person. So there are very good ideas, but there is not any consensus about what should be done everywhere. And another example of that is metal detectors. Metal detectors used to be not seen very much in hospitals as recently as a few years ago, or a couple of years ago. And they're still controversial as well. The idea being that people are coming to a hospital with emotional and medical needs, and they don't need to be treated as if they're going into an airport. I had reservations about metal detectors myself until recently, just because it didn't seem therapeutic. But if that's something that an individual hospital decides is important for safety of its patients, visitors, and staff, then it's certainly an option that ought to be looked at. Another subject that we've gotten a lot of questions about is tasers. Question being, should we arm our security officers with tasers? That is a very difficult call. CMS does not say no, although I believe they are skeptical and concerned about arming security officers with tasers. And there are some stories about things that have happened in hospitals in security responses that are troubling. What clients need to understand about tasers is that they require comprehensive training and retraining and security staff to understand that if a taser is used, it needs to be in response to a criminal situation, not as a clinical intervention.
Thanks, Eric. Very interesting. True to our promise, we've introduced the problem, talked about what state and federal lawmakers are doing and perhaps not doing to address the problem, and what employers can and are doing to comply with laws and support their workforce. To wrap things up, I'd like each of you to answer one final question. Eric, are there any significant legal challenges or controversies surrounding these emerging frameworks? Do you think that the recent Supreme Court decision in Loper striking down the Chevron doctrine, the judiciary's longstanding practice of deferring to agencies' reasonable interpretations of ambiguous laws, will affect the likeliness of OSHA regulations in this area?
There are many challenges in this area, and the risk of workplace violence in healthcare, I think it's generally agreed, cannot be eliminated, but can certainly be mitigated by the strategies that we've been talking about here today. Reducing the risk of violence in healthcare to zero is not attainable. We've been hearing from OSHA for years that they're going to promulgate a workplace violence prevention rule specifically for healthcare. In addition to talking about that, they've taken some of the rulemaking steps, including convening a small business advocacy review, which is required by statute. That was in March of 2023. We've been told that we will see the proposed rule go through the NPRM process, perhaps starting at the end of the year. I have my doubts about that. Again, there's going to be a new administration, and even though there was a regulatory push by the current administration, this particular rule seems hot enough, so it may not happen this year. When it does, and eventually OSHA is likely to put out a proposed rule and then a final rule addressing workplace violence in healthcare, I do expect a challenge to that rule based on recent Supreme Court decisions, including Loper-Bright, about the permissible scope of agency rulemaking and action. And we will watch as that plays out. And in the meantime, healthcare employers and the people who work in healthcare will continue focusing on this issue and making healthcare workplaces more safe for the people, all the people who are there.
Thanks, Eric. Sharon, besides EBG's 50-state survey on healthcare workplace violence laws, can you highlight one key resource or tool that employers can use to improve their workplace violence prevention strategies?
Sure, Avery. One of the things that comes to mind is there is a toolkit that was developed by the Washington State Hospital Association in conjunction with the Oregon Hospital Association, specifically regarding workplace violence. And it is really good. It's quite in depth and has significant resources that are cited, as well as a lot of ideas. So we can link that in the show notes, and you can find it readily online. It was actually just updated as recently as January of this year. So that's a very comprehensive resource for healthcare employers. In addition, most state OSHA agencies have resources available that they use regarding avoiding workplace violence or mitigating workplace violence. And if nothing else, if you're in a state that doesn't have a specific law or regulation to serve as a standard, you may want to take a look at that and see what your agency is thinking about, because that's what they're going to use when they come talking broadly about general safety obligations of the employer.
Thank you, Sharon and Eric, for taking the time to participate in today's discussion on healthcare workplace violence regulation and employer compliance. And thank you to all of our listeners. I'm your host, Avery Schumacher. If you like what you've heard today, please don't forget to subscribe. Diagnosing Healthcare is available wherever you get your podcasts.
Thank you for listening to Diagnosing Healthcare. For show notes on today's episode, additional episodes, and more insights on trending issues in healthcare and life sciences, please visit diagnosinghealthcare.com and be sure to subscribe on your preferred platform. This podcast is presented by Epstein Becker Green, PC. All rights are reserved. This audio recording includes information about legal issues and legal developments. Such materials are for informational purposes only and may not reflect the most current legal developments. These informational materials are not intended and should not be taken as legal advice on any particular set of facts or circumstances, and these materials are not a substitute for the advice of competent counsel. The content reflects the personal views and opinions of the participants. No attorney-client relationship has been created by this audio recording. This audio recording may be considered attorney advertising in some jurisdictions under the applicable law and ethical rules. The determination of the need for legal services and the choice of a lawyer are extremely important decisions and should not be based solely upon advertisements or self-proclaimed expertise. No representation is made that the quality of legal services to be performed is greater than the quality of legal services performed by other lawyers.